A sign of how delicate the negotiations are right now for the Obama White House when the Wall Street Journal reported this week that White House Chief of Staff Rahm Emanuel said the administration was not committed to a public option. The progressive backlash was harsh, so harsh in fact, the White House took the unusual step yesterday of issuing a statement clarifying the public option is President Obama's priority. Today at the White House, Vice President Biden announced a deal with some of the nation's largest hospitals that will save $155 billion in health care costs over 10 years. Now, the money is to be used to help pay for the 47 million uninsured Americans out there.
Reform is coming. It is on track. It is coming. We have tried for decades to fix a broken system, and we have never, in my entire tenure in public life, been this close.
And the key negotiators in Congress, like Democratic Senators Ted Kennedy, Max Baucus as well, began to put their cards on the table. A crucial question, though, is how far the Obama administration and the top Democrats will go to try and accommodate moderates. The moderates and many Republicans are backed by insurance company lobbyists who are spending over $1 million every day to try and water down reform. And joining us now is former DNC chair, Vermont governor, and healthcare crusader, Dr. Howard Dean. He's also, of course, the author of the new book, Howard Dean's Prescription for Healthcare Reform. Thank you so much, Governor, for joining us.
Thanks for having me on.
So let me ask you this. Why is there a perception that you almost are taking a stronger stand on what needs to be done regarding healthcare reform than the president, particularly with the public option?
Well, I think the president was the one that proposed the public option in the first place, and it makes sense. This is not an issue about conservatives and moderates and liberals and so forth. This is an issue about what works and what doesn't. This whole thing doesn't work without a public option. 72% of the American people think we ought to have a public option, and more than half of Republicans think that they ought to have the choice between public options and private options. So this is just common sense. And what you see in Washington is the incredible influence of the health insurance lobby, because you basically have a choice. This is a vote between whether you're going to vote for the American people or whether you're going to vote for the health insurance lobby. It has nothing to do with conservatives and liberals.
But what do you make of
moderates.
Rahm Emanuel implying, at least, that the administration was not completely committed to a public option, and there have been reports prior to that the Obama administration was willing to compromise at least somewhere there?
Well, you know, I'm not going to dissect what goes in the White House. I can't answer that, and who knows whether what the reporters actually heard or what they wrote. I just wasn't there, so I can't comment on that.
Sure.
But I think this is the president's proposal. The president gets that it's a $1 trillion proposal, and I think the Senate's done a great job to whittle back the cost. But this does not work unless you give the American people the choice, and you can't leave that choice up to health insurance lobbyists, and that's the battle. The real battle, as you said before, is not between conservatives, moderates, and liberals. It's between the health insurance industry and the American people, and now we're going to see where Congress comes down.
Governor Dean, some of your strongest supporters have been exceptionally nervous this week about what Tamron was getting at with the Obama negotiating position, the idea that maybe a public option is not necessarily a top priority. Are you convinced, as you say, that it makes common sense that a public option is the only way to fix this? Are you absolutely convinced that President Obama, the people around him in the White House, are just as committed to that as you and your supporters are?
I'm absolutely convinced that President Obama is. He's an incredibly bright guy, and he sees the...
What about Rahm Emanuel then?
Well, you know, I don't know. I mean, you get all these reports in the press, and I've been in this game long enough to know that the press often exploits things that people say in ways they didn't mean to say it. So, you know, who knows? I wasn't in that press conference, and I take
you must have an opinion then on when Rahm Emanuel's out there freelancing, giving these quotes to the Wall Street Journal, they got to pull it back. That means a key negotiator in all this has a different view than you and President Obama. Doesn't that make you nervous?
You know, that's not necessarily true. I think there were also reports that the chief of staff went before the Democratic caucus and said they were totally committed to the public option. So look, you see a lot of talk in Washington. What counts is the votes. We're going to see these bills come out and mark up and then votes fairly soon, and when we do, we'll know whether people are on the insurance company's side or people are on the people's side.
Governor Dean, the headline on Huffington Post is from an Esquire magazine article, and it says, Howard Dean, Washington is more resistant to change than anything except a few religious cults. Now, please don't tell me that this is a lie or that the media took this out of context.
No,
Did you
that's
say
true.
it?
I absolutely said it.
So how does that apply then to the health care reform and getting those Democrats to 60 and to stick together, as we've seen the Republicans behind George Bush when he wanted certain changes?
Well, are much better in following lockstep, but you can't accuse the Republicans of wanting much in the way of innovative change. Barack Obama is an innovator, and he's a real change agent. This is not a town that likes change. This is a town, as I discovered when I became DNC chair, this is a town where an awful lot of people believe if you keep doing the same thing, you may someday get a different result. That doesn't make any sense. This is a very conservative town with a small town. They just don't like change. We have a change president who ran on change. The American people believe we're going to get change. This is also a battle between Washington and President Obama. Will the president get the kind of change that we really have to have in health care? You have to have real reform. You cannot tinker around the edges in health care. It's just not going to work. We've been doing it for 60 years, and I don't think we ought to sink $1 trillion of our grandchildren's money into health care unless we're going to get real change.
All right, Governor Dean, it's always a pleasure to speak with you, and we hope that we are able to talk with you more often as this ball gets rolling.
Thanks very much.
Thank you, sir. So, David, interesting, a cult. Washington is a cult. You live in that town.
Yeah, well, he's right in a way, but, you know, Tamara, it's so interesting to hear Howard Dean. He's certainly a lot more sort of patient and cool about the negotiations that are going on right now than a lot of his supporters. But, I mean, this is it. I mean, the next week and a half, this is the high-stakes negotiation stuff. It's all going to come out, and you've got some very, very nervous people, a lot more nervous than the Governor Dean. So we'll see how it plays out.
And he wouldn't say it, David, but his language has, it seems, been stronger regarding public option than what we've been hearing from the White House in the past few weeks.
Absolutely. You're absolutely